I think oral care in oncology is a challenge across all gamuts of patients receiving any treatment, and I think it is a fundamental right for all patients to have really good mouth care, and I think it gets slipped under the radar. It's one of those things that people neglect in all professions because they're so tied up with the technicality of giving treatment now. So nursing has evolved, and I think it's one of those things that we forget, and I think our challenge is to bring that back as one of the first things that we do for anybody, because everyone has a right to have a clean mouth, even if they can't do it themselves. They need someone to help them do it. I think as a group it is about highlighting the importance of oral care. Because treatment has changed, patients have much more advanced treatments, they tend to be sicker, so the people in hospital tend to be much more unwell than they used to, and they receive lots more multiple treatments. So my colleague Jane is going to talk about radiotherapy, but lots of patients now are coming in and they may have failed first treatments. They may start off having surgery, they may then go on to chemotherapy, they might then have radiotherapy, but they also might end up having immunotherapy, which is a challenge for patients because they're on it for a long period of time, but also other things like tyrosine kinase inhibitors, which they're on, but also other treatments using isotope treatments. So for patients, they may end up being on treatment until they progress, and it's about looking after them, but educating them. It's not just about education of the healthcare worker, no matter who they are, because everyone's responsible for oral care, it's not just nurses, but also empowering our patients to know that good oral care is the most important thing that they can do for themselves. Want to get any guidance or support? We already have our second edition of the UKONS guidance on the website, and we are due to launch the third guidance, which is peer-reviewed, which is something that's got pull-out sections. You can laminate them, you can adapt it to your workplace, and then if you've got any questions or you want to contact us, all of our details are going to be on the website, and if you've got any ideas or anything, you can just let us know. But I think the fundamental thing is that oral care is absolutely important for every patient because it stops infection. These patients have a cancer anyway, so therefore they're already at risk of lots of other things, and we don't want to add infection via the mouth as I guess another thing that they have to deal with. I think the other thing to say about that is mouth care isn't just about care of the skin in the mouth, it's also about looking after your teeth to get rid of bacteria, and I think part of the group that we're devising is to make sure that we look at dental care as well, and I think that's fundamental again to good oral care. Whether you've got teeth or whether you've got some teeth, no teeth, you've still got to look after the oral cavity.